What's the difference between a hypnic jerk and a myoclonic seizure? Imagine lying in bed, feeling a sudden muscle twitch just as you're drifting off to sleep. That's often a hypnic jerk. But if you experience quick, involuntary muscle movements during the day or at unpredictable times, it could be a myoclonic seizure. These two phenomena might seem similar because they both involve sudden muscle jerks, but they are very different in cause, significance, and what they mean for your health. A hypnic jerk is a common, harmless muscle twitch that happens as you're falling asleep. It's a normal part of the sleep process and not linked to any brain disorder. These jerks usually happen during the transition from wakefulness to sleep and can feel like a quick startle or a sensation of falling. They are often accompanied by a rapid heartbeat, quick breathing, sweating, or vivid sensations, but they do not cause loss of consciousness or neurological damage. Most people experience hypnic jerks at some point, and they are considered a normal physiological response. Factors like stress, caffeine, irregular sleep schedules, or fatigue can make them more noticeable. In contrast, a myoclonic seizure is a brief, sudden muscle jerk caused by abnormal electrical activity in the brain. These seizures are a sign of epilepsy or other neurological conditions. They can happen at any time, not just during sleep, and may affect one part of the body or both sides. Myoclonic seizures are also very quick, lasting just milliseconds, but they can occur repeatedly and sometimes lead to falls or injuries if the jerks are strong enough. Unlike hypnic jerks, myoclonic seizures are part of a medical condition that often requires diagnosis and treatment. They may be associated with other types of seizures and can sometimes be a clue to underlying neurological issues. The key differences are in their cause and significance. Hypnic jerks are normal, sleep-related muscle twitches that do not require medical attention. They are a common experience and usually not a sign of any health problem. Myoclonic seizures, however, are caused by abnormal brain activity and are a hallmark of epilepsy. They often need medical evaluation, including an electroencephalogram, which records brain electrical activity, and sometimes neuroimaging, to understand the underlying cause. Duration and frequency also set them apart. Hypnic jerks are very brief, usually lasting just a moment, and tend to happen only when falling asleep. Myoclonic seizures are also brief but can happen multiple times and at any time of day or night. They may be isolated or part of a broader seizure disorder. Understanding these differences is important because it helps determine whether medical evaluation is needed. If muscle jerks only happen as you fall asleep and are infrequent, they are likely harmless. But if you experience sudden jerks during the day, or if they happen repeatedly, it's important to consult a healthcare professional. They can perform tests to diagnose whether you have a seizure disorder or if the movements are benign. In summary, while both hypnic jerks and myoclonic seizures involve sudden muscle movements, hypnic jerks are normal, sleep-related phenomena that do not indicate illness. Myoclonic seizures are abnormal brain events that require medical attention. If you or someone you know experiences unusual muscle jerks, especially outside of sleep, it's always best to seek professional advice to ensure proper diagnosis and care. Remember, only a healthcare provider can give personalized guidance based on individual health history.